Hello, dear everyone. I'm here to answer questions yet again and give you solutions of what works best and why. And we're going to talk about laxity. Look, laxity, okay? Everybody worries about their chin. Everybody worries about their neck. Everybody worries about their eyelids. Laxity. Gravity's working. It's pulling everything down to the ground. Your skin, as you go down the path of life, especially if you're not using supplements internally, you're not healthy internally, you're had lots of sun, you've damaged your DNA, you've damaged your collagen. You've got to make your skin work at the most youthful level of making new collagen because it's anti-laxity. Vitamin A plus is an imperative piece of your solution puzzle and for reversing, preventing, slowing down laxity. So vitamin A plus, what is it? It is a high dose stabilized retinol. It's equivalent to a pharmaceutical dose, and it penetrates in because the ingredients are all chirally, chemically correct. Your body recognizes it. They penetrate deeply to treat as much of the skin as possible. They force new collagen production. And what does that do? It lifts and tightens. So you've got to lift the skin. Vitamin A plus, you should be using it every night. Face, eyelids, neck, hands, chest. Vitamin A plus, high-dose retinol. There's a lot of retinols on the market, but they're not stabilized. So in the bottle, nothing's working. So it has to be stabilized and in a chemical form that will penetrate as deeply as possible from the top, the epidermis, down as deeply in the dermis as possible. So vitamin A plus, an imperative piece of your puzzle. Knowledge is power. So you know what to use that's going to give you the solutions you seek. Hope this helps. Thank you.